Hi, my name is Dr Somji. I'm a cosmetic surgeon here at DrMediSpa. I'm going to talk to you about fat transfer to the face. This involves adding volume to the face, similar to the way that we do with dermal fillers to the face. There's a number of differences between fat transfer and dermal fillers, and today we're going to talk about the advantages and disadvantages of both. So what are the advantages of dermal filler over fat? So dermal filler is far more specific and more measured than fat transfer. So if you imagine when we're transferring fat, sometimes you can't get such a specific result because we have an estimation in terms of the amount of fat that survives. With dermal fillers, as we inject, it remains that way. With fat, it can come down a little bit. So if you want a very specific result within a particular area, dermal fillers may be of more benefit than fat transfer. Another advantage of dermal fillers is that they're reversible, whilst fat is not reversible and it wears away over a longer period of time, even up to 3 to 5 years. And the only other advantage that I see from dermal fillers is that you can take it a little bit more slowly, so you can have multiple sessions to reach up to an advantage. What are the advantages of fat over dermal fillers? And this is a question that's asked to me by numerous patients in my consultations. Well, one thing is that fat is far more natural than dermal fillers. So it's your own stuff and you can't get allergic to it. Secondly, fat also lasts a lot longer when it takes than dermal fillers. It can last anywhere between 3 upwards of 5 years, and it can be performed quickly under local anesthetic with minimal downtime. Thirdly, with fat transfer, I take out 3 forms of fat. So we've got macro fat, which are larger fat cells that can be used in areas where you do have larger fat within your face. So for example, in the cheek area. We can take out micro fat for areas where you've got finer areas of fat, so in the nasolabial folds and maybe in the chin too. And we also take out nano fat, which is mixed with fat's own natural stem cells. So when you have a fat transfer treatment, you can get not only volumization, you can also get skin rejuvenation through injection of some of the stem cells too. The only disadvantage that I say with fat is that it's not immediately reversible, and it's never a problem under my hands because I always under-inject. So if I under-inject, there's no risk of you looking unnatural. And this is the reason why I always make sure that fat transfer treatments are extremely subtle. The individuals I recommend to have fat transfer to the face over fillers are patients that have had a large amount of fat loss throughout the whole face, and it makes financial sense to actually transplant fat within the area rather than using fillers for more longer lasting results. Other patients that are suitable for fat transfer are individuals that have had filler and it doesn't last. So there's a subset of patients, less than 1% of individuals, that have dermal filler and they metabolize filler a lot quicker than others. And this is why fat transfer is a great option for these patients. Thirdly, if you're one of my liposuction patients and you're having some fat removed and you've also wanted to add volume to the face, it can all be done under one procedure, and it can be like killing 2 birds with 1 stone.